Welcome to the enlightening world of transthoracic echocardiography. Imagine the ability to peek into the human heart, to see it in action, without a single incision. That's the magic of transthoracic echocardiography. It's a non-invasive diagnostic test that harnesses the power of ultrasound to create intricate, detailed images of the heart in real time. Now let's get to the heart of the matter. This technique helps us assess the structure and function of the heart. From the size and shape of the heart's chambers to the movement of its valves, every beat tells a story. It's like having a front row seat to the most extraordinary show on earth, the rhythm of life itself. So why are we learning about this? Because understanding the heart's structure and function is vital to identifying and treating cardiovascular conditions. With this understanding, we are ready to delve deeper into the process. Before we start, it's crucial to familiarize ourselves with the echo machine. The echo machine, an indispensable tool in the echocardiography process, is composed of three key components: the console, the transducer, and the monitor. The console, often considered the heart of the machine, is where you'll find the controls to adjust settings, input patient information, and save or print images. It may appear intimidating at first glance, but once you understand its layout, it becomes a powerful ally in your diagnostic arsenal. Next up, we have the transducer. This handheld device, also known as a probe, emits ultrasound waves and picks up the echoes as they bounce back. Transducers come in different shapes and sizes, each designed for a specific purpose, such as imaging certain regions of the heart. So, it's essential to choose the right transducer for the task at hand. Last but not least, we have the monitor. This is where the images captured by the transducer are displayed. Modern echo machines usually feature high-resolution color monitors that provide clear, detailed images. Now let's talk about adjusting settings for optimal image quality. Three fundamental settings you need to master are gain, depth, and frequency. Gain is essentially the brightness of the image. It controls the amplification of the returning echoes. Adjusting the gain too high will result in a bright, washed-out image, while setting it too low will yield a dark, hard-to-interpret image. Depth, on the other hand, determines how far into the body the ultrasound waves will travel. Adjusting the depth allows you to focus on the area of interest without unnecessary distractions. Finally, we have frequency. Higher frequencies provide better resolution but less penetration, while lower frequencies have greater penetration but poorer resolution. Therefore, selecting the right frequency is a balancing act based on the patient's body habitus and the specific area you're imaging. Now that the machine is all set, let's move on to the actual procedure. Patient comfort and proper positioning are key to a successful echocardiogram. Let's delve into the details of patient positioning and probe placement. To start, the patient should be lying on their left side. This position, known as the left lateral decubitus position, provides the best access to the heart and is most conducive for obtaining high-quality images. The patient's left arm should be comfortably placed above the head, and the right arm should be resting at the side. The patient's comfort should always be a top priority, as discomfort can impact image quality. Now let's talk about probe placement. The probe, also known as the transducer, is typically placed on the chest wall in the fourth intercostal space. That's the space between the fourth and fifth ribs. It's positioned to the left of the sternum at the point of maximal impulse. This is where the heart's beat can be most strongly felt, allowing for optimal image acquisition. The probe should be held steady with minimal pressure applied. Too much pressure can cause patient discomfort and may distort the images. The angle and rotation of the probe will vary depending on the specific view you're trying to obtain, but we'll delve deeper into that in the next scene. With the patient comfortably positioned and the probe placed, we can start recording images. A comprehensive echocardiogram includes several standard views. Dive right in, we'll start with the parasternal long-axis view. This view offers a cross-sectional image of the heart. We can see the left ventricle, the right ventricle, the aorta, the left atrium, and the mitral valve. Here, we measure the size of the aortic root and the left atrium and assess the function of the mitral and aortic valves. Next up is the parasternal short-axis view. This view is like slicing the heart into cross-sections, starting from the base and moving towards the apex. It provides an excellent perspective of the left and right ventricles and the interventricular septum. Here, we assess the thickness of the ventricular walls and the motion of the interventricular septum. Moving on, we have the apical four-chamber view. This view, as the name suggests, shows all four chambers of the heart: the right and left atria, and the right and left ventricles. We can also see the tricuspid and mitral valves. In this view, we measure the sizes of the chambers and evaluate the function of the mitral and tricuspid valves. The apical two-chamber view is similar to the four-chamber view, but it focuses on the left side of the heart. This view gives us a better look at the left atrium and left ventricle, and the mitral valve. Here we measure the size of the left atrium and left ventricle, and assess the function of the mitral valve. Last but not least, we have the subcostal view. This view is obtained from beneath the rib cage and provides a unique perspective of the heart. We can see the atria, ventricles, and the inner atrial and interventricular septa. Here we assess septal defects, pericardial effusion, and the size of the inferior vena cava. Now, let's talk about the parameters to record. In each of these views, we measure the sizes of the chambers and the thickness of the walls. We also evaluate the motion of the valves and the septa. These measurements give us information about the heart's structure. We can detect abnormalities like enlarged chambers, thickened walls, or defective valves. But that's not all. We also assess the function of the heart. We look at how well the heart is pumping blood, how the valves are opening and closing, and how the septa are moving. This functional assessment gives us valuable information about the heart's health and performance. In summary, each echocardiographic view offers a unique perspective of the heart and its components. By recording specific parameters, we gain a comprehensive understanding of the heart's structure and function. This information helps us identify abnormalities and monitor the progress of heart disease. These views and parameters provide a wealth of information about the heart's structure and function. Interpreting the echocardiogram requires skill and knowledge. Let's delve into how this intricate process unfolds. Firstly, the interpretation of echocardiographic images is a two-step process. The first step is identification, where you need to recognize the anatomical structures and the echocardiographic views. The second step is analysis, where you assess the function and condition of the heart structures. Interpreting an image starts with understanding the normal. The heart should have a specific shape and size, and the walls should move in a coordinated manner. Certain parameters like the size of the chambers, the thickness of the walls, and the function of the valves are crucial to note. However, not all hearts we encounter are normal. Abnormal findings can range from dilated chambers to thickened walls, from valve stenosis to valve regurgitation. In some cases, you might spot clots, tumors, or pericardial effusion. It is essential to recognize these abnormalities and understand their implications. Once you've interpreted the images, it's time to create the final report. This is where your findings are documented, and it serves as a comprehensive record of the patient's cardiovascular status. The report should begin with the patient's details and the indication for the echocardiogram. Following that, document the technical quality of the images and any limitations you encountered during the study. Next, describe your findings systematically. Start with the general impression of the heart, such as its size and function. Then proceed to detail the findings from each echocardiographic view, focusing on the chambers, walls, and valves. Be sure to include measurements and compare them to the normal range. If any abnormalities are detected, describe them accurately and note their severity. It's also helpful to mention any associated findings that could provide context to these abnormalities. Finally, you'll draw a conclusion. This should be a synthesis of your findings, where you identify any cardiac conditions present and comment on their severity. It's also the place where you answer the clinical question that prompted the echocardiogram in the first place. Remember, the report is not just a collection of findings. It's a communication tool that aids the referring physician in understanding the patient's cardiovascular status and planning further management. And that, folks, is how a transthoracic echocardiogram is conducted and interpreted. So, what have we learned today? We've delved into the fascinating world of transthoracic echocardiography, a non-invasive procedure that provides valuable insights into the heart's function and anatomy. We started by setting up the echo machine, a crucial step in ensuring accurate and reliable results. Then, we discussed patient positioning and probe placement, both of which play a significant role in obtaining clear and detailed images. We also explored echocardiographic views and parameters, which are the building blocks of a comprehensive echocardiogram. By understanding these different views and what they represent, we can better interpret the data and make accurate diagnoses. Lastly, we looked at interpreting the images and creating the report, translating the technical information into a format that can guide patient care. This was just a primer, a stepping stone into the vast field of echocardiography. Thank you for joining us on this journey through transthoracic echocardiography. Until next time, keep learning.